We will get started again with the rest of our afternoon. I do want to remind you at 1 o'clock when this is over, we will have box lunches for you to either stay here and eat or take with you if you need to go or back to your offices. It is my sincere pleasure and just complete honor to introduce to you Gavin McCool. I've known Gavin for many years. He is an excellent student, a sophomore at Trinity Episcopal School. He is an incredible athlete, and he's also somebody who just happens to suffer from Tourette Syndrome. And one of our goals at SHRM is to always learn and understand. And of course, we always want to be understanding more about people in the disability community and eliminate stereotypes that might prevent us from hiring somebody as fabulous as Gavin McCool. And so Gavin is and has been selected as a student ambassador for Tourette's. And yesterday, he was spending the day in Washington meeting with Eric Hanner, who was discussing issues and disabilities. And it is my sincere pleasure to introduce Gavin McCool to you today. Gavin?
Good morning, everybody. As Michael said, I'm Gavin McCool, 15 years old. I go to Trinity Episcopal School. I'm a sophomore. I do suffer from Tourette Syndrome. I've had since I was in about first grade, so age-wise, I'd say 7 years old. And also, like she mentioned, I was just recently selected by the National Tourette Association to be a youth ambassador and, go around and talk to people, make speeches, spread the word and awareness for Tourette Syndrome. I went to D.C. back in March with about 45 other kids from 26 states, and we had training and spent 2 days there and went to Capitol Hill and met with a lot of congressmen, walked around Capitol Hill all day, tried to spread awareness and even sign on to a congressional caucus for supporting funding for Tourette Syndrome. So today, hopefully, my goal here is getting this full day of school and everything like that. Hopefully, aside from that, I'll be able to clear up any misconceptions that you have or anything you don't understand about Tourette's, as well as explain what it's like living with the condition, and then also telling you guys why it shouldn't be a problem hiring somebody who has Tourette Syndrome. So at this point, I'm trying to keep it to a minimum. I don't know if you guys have noticed or anything, but I'm going to ask you if any of you have noticed anything that I've been doing, maybe noise I've been making, or motions I've been moving. If anybody's noticed, I'm going to tell you to feel free to say anything.
I noticed your head.
My head, taking back and forth like this. I twitch my head sometimes. I also, if you don't notice, I go, I make noise with my mouth, like, whoo, something like that. Something that make people feel a little uncomfortable, but I mean, you get used to it. Everybody in my class, they always tell me, they know when I'm not in class or when I'm not in school because I'm not making noises in the back of the classroom. That's a basic overview of Tourette's, and tell you about what it is. So you may be thinking, after that overview, what it is exactly, and that's what I'm here to explain to you. In a few minutes, I'm going to explain to you now, but in a few minutes, I'm going to give you a little situation where you can experience sort of what it's like to have Tourette's for yourself. But for now, I'm just going to tell you that Tourette's is a neurobiological disorder. It results in motor and vocal tics. The tics are involuntary, they're rapid, and they're sudden. You can't feel them coming on, they just happen. Examples of these would be sniffling, coughing, eye blinking, and not just one eye blinking, like eye blinking a bunch, and a lot more aggressively than normal. They're almost like the urge to sneeze, or if you have an itch on your foot, you have to sneeze, you have to itch your foot, you have to do it. You can't control it, and just like any of those other things, if you do try and control it, it takes way too much energy, it's uncomfortable, and then when you're done controlling it, it's actually proven that if you try and control your tics, that eventually when you have to stop, they're going to come out much worse, and you're going to have basically a ticking attack just from trying to control your tics. There are two kinds. I briefly touched these. I didn't tell you what they were. They're vocal and motor. There's complex and simple tics, and their name should basically tell you what they are, complex and simple. Complex tics are more severe. They usually involve blurting out words, clapping hands, or moving legs, things that are really noticeable and can even cause injury in some people or cause things to be a lot of trouble. simple tics are things like whistling, coughing, making noises, things that aren't really that much of a problem, but are just uncomfortable and can make other people feel uncomfortable. There are also vocal tics that involve involuntary repeating of words. I don't know if any of you guys saw, there was on the news maybe 2 weeks ago, there was a guy in the airport, and he suffered from Tourette syndrome and bombed, you know what I'm talking about. And I guess he was nervous that there was going to be, he was getting on the plane, and I guess he was nervous there was going to be bombing or something like that. So he kept repeating the word bomb over and over in the line. And eventually security, pulled him out of line, was like, he keeps saying bomb, and he can let you get on this flight. Even though he couldn't control it, it was just something that he was saying and doing out of his control. I think if any of you here actually have heard Tourette before and didn't know about the smaller parts, I'm sure you probably heard of Cochlealia, which is the Hollywood version of Tourette's that less than 10% of people who have Tourette's have, and it's the uncontrollable blurting out of profanity and screaming at people and saying things that aren't necessarily the nicest things to say uncontrollably. And like I said, less than 10% of people have that, so that's one of the main things I like to focus on being able to understand about Tourette's is that that's not what everyone who has Tourette's has. The majority of people who have Tourette's don't have that, and it's not appreciated when people are assuming that that's part of it. There are also tics in the mind, which are a little bit more confusing than the complex tics and the simple tics. Tics that are noticeable. Tics in the mind are almost like OCD. You think something and you have to do it. Like if I'm writing a word and it doesn't look right in your mind, certain words, you got to cross it out and rewrite it until it looks right to you. Or if you do something that you do every day and you don't do it, then you have to do it again. It's literally just almost like OCD. Tourette's is probably caused by normal metabolism of at least one brain chemical. So it's basically misfiring of your brain chemicals, and it's not anything serious. It just, is one thing that's gone that makes you twitch your hand or makes you make a noise that most people wouldn't normally make. And the statistic used to be, I think it was every 3 in 1,000 kids who were born were diagnosed with Tourette's, and the number keeps rising. Now it's at 6 in 1,000 have Tourette's. And 10 through 25% of school-age children also have Tourette's. They typically appear like mine did between ages 5 and 7, and before you hit the age of 18. And it's also 3 times more likely to occur in males than it is in females. I don't know why that is. I don't think a lot of people know why that is. It's just how it is. TS is also, I learned this when I was in DC at the training. I thought TS was just something that you got. It wasn't anything that caused it. I didn't think it was inherited, but it turns out that it actually is inherited. It's just like hair color or eye color or anything else that you would inherit from family members. It's somebody down the line in your family has had it before you. And then, like I said earlier, other disorders like OCD and ADHD can be associated with TS. It's one thing I find most shocking is that Tourette syndrome's been around for over 200 years, and to this day, there's nothing that actually cures it or nothing specifically for TS that helps it. Research is continuing. People are hoping to find treatments, but everything right now that is being used to treat tics or being used to stop, blurting out is things that aren't meant for Tourette's. I used to take medicine that was for blood pressure, and because it would help you with the Tourette's, it would help the ticking. But it also, it's the good and the bad. It's you get the puffy tick, but then you have to deal with the blood pressure and everything else that comes with it. I was telling my dad I just don't taking medicine anyway, so I stopped taking it and just deal with the ticks. I mean, me personally, I don't mind my ticks. I like my ticks. People give me nicknames. People call me Squish. They've been calling me Squish ever since 5th grade. I actually enjoy it, but so that's basically a little bit about Tourette's in general. Now now, what I was talking about earlier, this is your chance to your little scenario and give you to experience it. I guess all of you have a pencil and paper. If you do, I'm going to ask you to get that out and be ready to write something for me real quick. Alright, okay. So what I'm going to have you do is, I just told you about the different types of tics, and I'm going to give you one motor tic and then one tic in the mind. And what you're going to be doing is I'm going to give you 90 seconds to write the pledge. An average person takes 9 seconds to write the pledge, and I'm assuming you all know the pledge. If you don't, I'm not going to tell you. Just, have to look on with your neighbor. So I'm going to give you 90 seconds to write the pledge, but I'm going to tell you that every time I clap my hand, I want you, when you're writing with your pen, I want you to stop and then turn it over, touch the back of your pencil to the ground, pen or pencil to the ground. And that's every time I clap. And then every third word you get to, cross it out and then rewrite it. And then that's the only two things you're going to do. Just every time I clap, when you're writing, take your pen over, touch the back of it. And then every third word you get to, cross it out and rewrite it. I'm going to give you 90 seconds to do that. So if everybody's ready, you can go ahead and start now. Alright, you can go ahead and stop. You guys typically, it looks like you did a little bit better than most people normally do. How many of you finished it by doing crossing off the third word? Nobody? Nobody finished? Alright. That just proves my point, how it's difficult, when you're taking, it's hard to focus. It might pose, even though it's tiny, it might pose a problem. When you're doing something, it's difficult in everyday situations. And while you were doing that, since you guys are the ones who are doing it, I'm going to ask why you thought it may be difficult. Why was something you think may be difficult to have to take every now and again, have the noises going on and everything that's happening. Just some feedback on why you think that might be difficult. Why that happened?
It's
Disruptive. It's very disruptive. Yeah, people to yourself, and then also people around you. When I take my exams, that I'll be taking about a month from now. When I take those, I take them to the library separate from everyone else who takes them in the classes, partially because it helps me focus more, but also so I don't distract other people who are in the classroom. And I have the benefit of knowing, that most of my classmates are used to it. It doesn't bother them, but when we're taking something like exams, you don't want to bother people like yourself not be able to focus. So then what you just did is, when I do another group of Tourette's every day, multiply how many times you did it by about 10,000, you might get a couple of hours. But after all that, what I'm here to tell you, my point I'm going to prove is that even though I have Tourette's, I'm completely normal. Even though I make noises or twitch, I'm normal. I do things that any other normal 15-year-old does. That's my mom. She'll tell you. She says, I don't make my bed. I don't keep my room clean. Or I stay up too late. Along with anything that a normal 15-year-old does, I also do more 3-sport varsity athlete. I play varsity football, I'm a varsity lacrosse player, I'm a varsity wrestler. I ride dirt bikes. I drive a car. I try to keep my grades up. I behave like any other normal kid behaves. I'm planning on going to college and applying for a job just like anyone else is. And I have high expectations of myself, and so does my family. there's nothing that should be stopping you from hiring me or someone like me for a position, because our ability to perform at a high level is no different than anyone else's. Personally, I know of teachers. There's in DC, we met a neuroscientist who had Tourette's, and there's professional athletes who have Tourette's. The U.S. Olympic soccer team, their goalie, I forget his name. I don't remember his name. He has Tourette's, and it just proves a point that Tourette's is everywhere, and there's people living their lives, more than people who don't have Tourette's and know they have Tourette's. So I'm just here, to ask for your awareness of it. I'm not sure what direction I'm going to head in professionally yet, but I'm hoping that the spread awareness that eventually, when I do get the job, my boss, somebody who's in control of me, knows what Tourette's is and understands it, and accepts that, the two words having Tourette syndrome doesn't define who you are, it just defines part of who you are. It's almost like your personality. So thank you guys for listening to me today, and if you have any questions, I can answer any questions. I'll be hanging around for a while. And then out in the lobby area, when you walk out, over your left, there's a little table with some information on TS if you'd like to read more about it.
Thank you, Gavin. As a token of our appreciation, thank you for coming in. Who does not want to hire Gavin? A 15-year-old could come up here and give a speech like that, let alone somebody who has Tourette syndrome. And it just shows why we have to always keep up on being informed about understanding and eliminating stereotypes in the workplace. It would be awesome to work with Gavin McCool. We just have to make sure our hiring managers understand that when fabulous 3-varsity sport excellent student Gavin McCool comes in to interview and has a tick, that doesn't mean he can't be a productive, phenomenal employee for our workplace. So that is what we are at SHRM. We learn how to understand stereotypes and we pass that on to our workplace. Thank you, Gavin, for being such a phenomenal ambassador for Tourette syndrome and for really anyone who has this